For real this time. 58 seconds, 56 seconds, 50 seconds, 45 seconds. Thirty seconds out. Fifteen seconds out. 10, 9, 8, 7. Good afternoon, and welcome to the National Press Club, the place where news happens. I'm Lisa Nicole Matthews, the 114th president of the National Press Club and assignment manager for U.S. Video at the Associated Press. Thank you for joining us, both those who are here in the ballroom and those viewing online, for our headliner event with Secretary of Veteran Affairs Denis McDonough. As we commemorate Veterans Day this week, along with the 100th anniversary of the establishment of the Tomb of the Unknown Soldier at Arlington National Cemetery, for those planning a visit to Washington, the public can actually visit and pay respects at the tomb in a flower ceremony being held today and tomorrow. For those of you watching our headliner today, we are happy to accept your questions, and I will ask as many as time permits. To submit a question, please email headliners@press.org and put veterans in the subject line. For those of you in the room, we have circulated cards on which you may write your questions. For our online audience, please be aware that in the audience today are members of the general public, and we are so happy to have you here. And so any applause or reaction you hear is not necessarily from the working press. Let me begin by introducing the head table, and I'd like to ask you to please hold your applause until all of the head table guests are introduced. From my left and your right, Ken Dalecki, U.S. Navy Vietnam veteran and member of the American Legion Post 20 and member of the National Press Club. Matt Quinn, Undersecretary of Memorial Affairs at the U.S. Department of Veteran Affairs. Kevin Winsing, retired U.S. Navy captain and Headliners team member who helped arrange today's event. Dr. Mark Upton, Acting Deputy Undersecretary of Health for Community Care. And Max Lederer, publisher of Stars and Stripes. And from my right, your left, Vicki Jordan Adams, Senior Advisor at Finsbury Glover Herring. Myron Belkind, Vietnam veteran, professor at George Washington University, and past president of the National Press Club. Mike Frew, Principal Deputy Undersecretary for Benefits in the Veterans Benefits Administration. Jen Judson, defense reporter with Defense News and vice president of this National Press Club. And finally, skipping over our guest of honor for a moment, Lori Russo, president of Stanton Communications and co-chair of our Headliners team. Thanks, everyone. And now for our guest of honor. For years, veterans and the U.S. Department of Veterans Affairs have struggled with the persistent issues of access to quality medical care, high suicide rates, and homelessness. In recent weeks, all of those issues have risen to the top of the agenda for VA Secretary Denis McDonough, who has led the VA since February 8th. Many veterans are struggling with COVID-19, lasting physical and invisible combat wounds, adapting to civilian life, and mental health. A report made public in September indicated that vets comprise 14% of all adult suicides in 2019. Access to care is among the top issues for the VA. Veterans appear to have had difficulty accessing care specifically in rural areas of the country. According to the National Center for Veterans Analysis and Statistics and the U.S. Department of Veterans Affairs Office of Rural Health, of the nearly 20 million veterans in the United States, 4.7 million live in rural America. 2.7 million, or 58% of these rural vets, are enrolled in the Veterans Affairs healthcare system, with more than half affected by a service-related condition. The task of ending homelessness among the nation's veterans is immense. According to the Department of Housing and Urban Development, more than 37,000 veterans are homeless. And if that wasn't enough, tackling backlogged benefit claims is front and center for the agency and for Secretary McDonough. The VA recently announced that it would hire 2,000 new claims processors to address more than 260,000 benefits claims that have languished for more than 125 days. That's a lot. We are looking forward to hearing more from Secretary McDonough about these and many other issues. Secretary McDonough, welcome to the National Press Club. The floor is yours.
Thank you very much. Well, good afternoon, everybody. Thank you very much, Lisa, for the kind introduction, for your steadfast leadership of this august National Press Club. It's great to be here. Before I get into my remarks, I want to take a moment to recognize and remember Senator Max Cleland, an indefatigable public servant and patriot who just passed away. Senator Cleland served everywhere, from the jungles of Vietnam to the halls of Washington to his beloved home state of Georgia, a war hero, and importantly for me in this job, the father of the modern VA. It's hard to overstate how he modernized VA for his fellow Vietnam vets. Uniquely for that time, he understood that we at VA work for veterans. We work for veterans, not the other way around. And instilled that ethos in everything we do. And it's that same ethos that informs President Biden and, accordingly, me and the rest of our team to this day. We will all miss Max Cleland dearly. I also want to recognize the other folks in the room today. The great journalists who cover veterans, service members, day in and day out. The folks from the press club who set this event up so we could gather safely amid the pandemic. The veterans and military service organizations. I see one particularly indefatigable advocate out there. And the work that you do to look out for vets 24/7. Everyone who's watching online or listening on the radio, including my VA employee colleagues who do incredible work every day and have particularly thrived in their work, notwithstanding the pandemic. And most of all of the veterans who are here with us today. In person and online, my deepest appreciation to you and heartiest Happy Veterans Day to you. It's an honor to be here with all of you. You know, we're just 2 days away, as Lisa said, from Veterans Day, the day when America pauses to remember and recognize the millions of brave men and women who fought our nation's wars and defended us during periods of restless peace. Veterans Day is, of course, a day to honor these veterans, a day to remember all they've done and sacrificed for our country, a day to recognize that when those veterans serve and sacrifice, so do their families, their caregivers, their survivors. But critically, Veterans Day is a call to action, a reminder that it's our responsibility as Americans to serve those who have served our country, to fight for those who have fought for us. Remember that as a country, we now rely on a very small percentage of our population to fight for the rest of us. You might suspect that I'm particularly sensitive to this issue as a non-vet myself. And I am. Because the risk is that vets and non-vets wind up occupying two separate realities in America, leaving some vets feeling isolated or fearing that the rest of the country does not appreciate what they've done for us, what their families do for us. The thing is, it's not on vets to break down that barrier. It's on all of us, particularly us non-vets, to break down that barrier and to serve vets with as much heart and soul as they've served us. Fulfilling that obligation can come in a lot of forms. For most Americans listening today, it can be something as simple as reaching out to the vets in their lives and lending a hand. For the great reporters in the room today, it means telling the stories of veterans and service members of the wars they fought and the challenges they face, stories that in many cases would not otherwise be known. And at VA, it means providing veterans with world-class and timely, as Lisa just pointed out, timely health care, with the benefits they've earned and so rightly deserve, and with a lasting resting place that is a tribute to their service. The point is that we all have a part to play, no matter who we are or what position we hold. So as we approach Veterans Day, I ask that everyone watching or listening today renew that commitment to serving veterans and to serving them well, because that's our most sacred responsibility on this Veterans Day and on every day. This afternoon, I'd like to give an update on what we at VA are doing to keep that promise to our veterans, their families, their survivors, their caregivers. And it starts with, as Lisa indicated, responding to the pandemic. It's been devastating for all of us. We've lost so many veterans we serve, the colleagues we work with, the family and friends we love. But serving veterans well means stepping up in times when they need us most. And that's what VA's incredible employees, embodied by Dr. Mark Upton, have done during the pandemic. I'm pretty biased on this, so don't take it from me. Take it from Marine Corps veteran Ronald Pipkins. At the beginning of the pandemic, Ronald walked into the Los Angeles VA Medical Center with a mild fever and a cough, but his symptoms quickly worsened. His doctors had to act fast, so they put him onto a ventilator and into a medically induced coma, where he would remain for a month. Fortunately, VA doctors and nurses were able to pull him through. And 6 weeks after he entered the hospital, he was able to go home. Later, when Ronald was asked if he was nervous about returning to the medical center where he'd been in a coma, he said, "No, not at all. The people who saved my life are there." I'm always excited to be here because this is where heroes work. I tell this story because Ronald's right. VA employees have been nothing short of heroic during the pandemic, often risking their own lives or putting their families at risk to save the lives of veterans. When COVID first hit, they worked late nights, early mornings, everything in between to make sure our vets received the excellent care they needed, that they deserved, that they earned. When PPE was running low, they invented reusable 3D printed PPE and got it straight to the front lines. When it wasn't safe for vets to come to the hospital, they cared for vets online, ramping up telehealth appointments from 2,500 per day in March 2020 to 45,000 per day a year later. When the vaccine became available, they sprang into action, vaccinating more than 4 million people and implementing the first vaccine requirement in the federal government. And when non-vets needed help, they stepped up as part of our fourth mission, deploying to hotspots and providing beds for hundreds of COVID patients, non-veteran COVID patients in need, all the while never once denying a bed to a vet. All that work translates into the one statistic that matters. Veterans' lives saved, veterans' lives improved. And look, all that work has made VA into something different. Max Cleland made the VA into something different. And our employees during this pandemic are doing it again. Something new. We want our lives to get back to normal. We were just talking about it right here. But at VA, there's no going back to the old normal. Because the work we've done to respond to the pandemic has forged us into a stronger and better department for the nation's veterans. Telehealth, teleappeals for your claims, the Veterans Legacy Memorial, and our new VA mobile app are allowing us to meet vets where they want, when they want, in unprecedented ways. Outpatient scores for vets in our outpatient care rose to 90% this year. 90% trust rating, which in my mind should be the floor, not the ceiling. We've seen more patients and held more benefits hearings than in any previous year in VA history, a result of our goal to make sure vets get their care and benefits on time, every time. Our cemeteries not only stayed open during the pandemic, but we expanded to 6 new locations. And the pandemic has underlined the importance of our effort to establish national standards of practice, which will ensure that VA's providers can deliver the same great care and access to all veterans, no matter where these providers are working or deploying across the country, across any state line, especially during times of crisis. All in all, we are now providing more care and more services and more benefits to more veterans than ever before. So as we look to the future, we're not trying to build a VA that goes back to the old normal. Instead, we're going to continue to do better for vets. We're going to continue to be better for vets. And we're going to do that by driving toward the 4 fundamental principles that shape our vision for the future: advocacy, access, outcomes, and excellence. Advocacy. We're making sure that VA is the nation's premier advocate for veterans, their families, caregivers, and survivors. And when it comes to advocacy, it starts at the top. With the military family in the White House, our shared mission could not be a higher priority for this administration, nor could it be closer to President Biden and First Lady Dr. Biden's heart. When President Biden nominated me to lead the VA, he told me to fight like hell for our vets. That's what we're doing. This administration and Congress are doing the same. Delivering for our vets at the American Rescue Plan, which allocated $17 billion additional dollars to help us care for vets during the pandemic. The proposed reconciliation package, which has $5 billion to help vets thrive in the future. The Save Lives Act, which empowered us to vaccinate not just vets, but spouses and caregivers. And with H.R. 5671, a proposed expansion of that same act that would allow caregivers and their spouses to get flu shots at VA when they come in for their boosters. The House Veterans Affairs Committee moved this last week, and I urge Congress to send it to President Biden's desk as soon as possible. And look, there's so much more where that came from. The bottom line is that every part of this administration is focused on fighting for veterans every day. Second, on access. We'll move heaven and earth to get veterans timely, again, I assert, Lisa, timely access to their VA resources. A major part of that equation is making sure that veterans have the best possible experience wherever they access VA benefits and services, at home, in the community, or from us at VA. That's why we're meeting vets where they are, expanding telehealth and teleappeals by supporting caregivers. So let me say this clearly on caregivers. Caregivers are not an afterthought for us. They're our top priority. That's why I appointed the VA's first ever senior advisor for caregivers, Meg Cabot. It's why the program of comprehensive assistance has enrolled more than 30,000 unique caregivers and veterans in the last year alone. And it's why this coming October, we will expand the program of comprehensive assistance to cover all generations of caregivers. For vets who are getting care in the community, we've built networks that have the right providers in the right locations to meet their needs no matter where they live. And we're finally paying our bills on time. Most importantly, we're dedicated to delivering a world-class experience for vets who get direct care from VA. That means finding the right balance between direct care and community care, putting the direct care system on a sustainable path to ensure that future generations of veterans enjoy the same great VA health care that past generations did. It means building an electronic health record system that allows vets to seamlessly access their records wherever they receive care, from the first day they put on the uniform to the last day of their life. And it means rebuilding, repairing, and realigning and modernizing VA's healthcare infrastructure to meet all veterans' needs. Because that infrastructure is critical for the health of our nation's vets, and we learned during this pandemic, the health of non-vets as well. VA is the backstop and the innovator at the heart of the entire healthcare system in the United States. Training America's physicians, up to 70% of them, train in our facilities. Researching tomorrow's challenges. The one place doing work on long COVID today, VA. And innovating today to overcome those challenges. That is never going to change. And it sure won't change on my watch. Outcomes. Outcomes drive everything we do. Because as Max Cleland insisted, vets, not us, are the ultimate judge of our success. There's no more important outcome than preventing veteran suicide. Because one veteran who dies by suicide is one too many. Mental health services are critical for suicide prevention, so keeping them going during the pandemic has been our primary focus. Fortunately, vets have adapted seamlessly to telemental health sessions, attending 5.6 million sessions already this year, more than doubling last year, 5.6 million sessions. We've also massively ramped up our lethal means safety efforts, putting time and space between veterans in crisis and their firearms by passing out more than 9,500 gun locks this year alone, and by launching an awareness campaign for veterans and their families that's garnered over 1.7 billion impressions. And in the aftermath of the war in Afghanistan, we've reached out to every veteran in our network to remind them that their service matters and that we're here for them. Whether they want to speak to another veteran, talk to a therapist, call our crisis line at 800-273-8255, text us at 838-255, visit one of our vet centers, or access any of VA's mental health services online at mentalhealth.va.gov. We are standing by and we're here to help. Today and every day. Because mental health care is health care. As the Secretary of Defense has said, mental health is health, and veterans' health is our top priority. Another major focus here is toxic exposure. We're not waiting for Congress to act on this. We're going ahead and acting ourselves. We've already announced 3 major updates. First, we're creating new comprehensive decision-making model for determining presumptive conditions, a model that will be guided by one core principle: getting veterans the benefits they've earned and therefore deserve. Second, veterans suffering from bladder cancer, hypothyroidism, and Parkinsonism due to Agent Orange can now be paid the benefits they're owed. And third, for the first time in VA history, we are presumptively paying toxic exposure claims to Gulf War veterans from 1991 to today. Specifically, those who suffer from asthma, sinusitis, and rhinitis, and we've delivered millions of dollars in benefits already. Veterans have waited long, far too long, for those benefits. And we're doing everything in our power to make sure they won't have to wait any longer. This is just the beginning, not the end of those efforts on toxic exposure. And we're moving ahead with the utmost urgency. Lastly, on outcomes, we're laser focused on ending veterans' homelessness. You know, earlier this summer at a homeless vets vaccination event outside VA headquarters, a veteran came to get his shot. He wasn't wearing shoes. So we got him vaccinated, and our canteen staff got him a new pair of shoes. On the one hand, the story's heartwarming. A job well done. On the other, it's heartbreaking. That man served our country. He should have shoes on his feet. He should have a roof over his head. In fact, there should be no such thing as a homeless veteran. Not here, not in the greatest country in the world. So I assure you, we will do whatever it takes to get the country's 40,000 homeless veterans into homes and to keep them there. Finally, excellence. We're seeking excellence in all we do for veterans by leveraging the strength and diversity that defines our veteran population, our VA workforce, and in fact, this amazing country. Our diversity is our strength, never a weakness. Every person entering a VA facility, including the rapidly growing cohort of women veterans, must feel safe, free of harassment and discrimination, and we will welcome all veterans. One of my first actions as VA Secretary was ordering a top-down review of all our policies to determine how we can make VA a more welcoming place for LGBTQ+ veterans, women veterans, veterans of color, MST survivors, and all others. Now, there's much more I could say here, but it all boils down to this. For too long, too many veterans have fought to protect our rights and freedoms, my rights, my freedoms, and have had to fight brutal battles here at home for their own rights and freedoms. Tragically, some of those fights continue to this day. But at VA, those fights are over. I repeat, at VA, those fights are over. In this administration, nobody is going to have to fight to get the quality care, benefits, and services they've earned, no matter who they are or who they love. So that's where VA is headed, continuing to deliver more care, more benefits, more services to more veterans than ever before. And being here at the National Press Club, it reminds me that we cannot do that great work without you, the journalists who tell the stories of our veterans. Nobody better exemplified that than Joe Galloway. I'm sure you know Joe. He was the only civilian to receive the Bronze Star for heroism in Vietnam. And he passed away earlier this year. An incredible man, an exceptional reporter, who went to greater lengths than just about anyone to tell the stories of veterans and service members. And of that work, he once said, "You pay the price to tell the story. But the story is worth telling." The story is worth telling. He's so right. And it's a reminder that we wouldn't know so many veteran stories if not for the journalists who risk it all to tell them. Journalists like Kelly Kennedy, an Army vet who's pioneered reporting on burn pits. Jim Porta, a Marine veteran who has done groundbreaking reporting on military sexual assault and harassment. Austin Tice, a Marine veteran who risked everything to tell the world what was happening in Syria, and whose mom, Deborah, is with us today. Austin, if you're listening, Hoya Saxa. You're in our hearts and our minds every day. And as Secretary Blinken said in August, we're working around the clock to bring you home. The list could go on and on. There are so many courageous journalists who are covering veteran and service member issues right now. And the stories that all of you tell, the truths that all of you tell, are often not easy, including the truths that Lisa told to introduce me. It's true that we fall short. Sometimes they require to tell those truths that you brave bullets. And sometimes they require that you brave backlash here at home, but they're always important, both for the American public to hear and, as with your introduction, for us at VA to hear. Because those stories make us better. They help us better understand what veterans experienced in war, what they're going through here at home, and how we can best help them. So thank you for your magnificent work, your partnership, for putting up with me, and most of all, for telling those stories. I promise to always be transparent with you and to learn from you. And on this Veterans Day and every day, I promise to fight like hell for the vets who have fought for us. God bless you. God bless our nation's troops, our veterans, their families, caregivers, and survivors. And may we always give them our very best. I look forward to your questions.
Is this on? This never gets old. This is amazing. Thank you so much.
Thank you.
Is this on? Can you hear me?
I can hear you.
Yeah, I know you can.
I don't think so.
No? Can you hear me? Okay, now you can. Fantastic. Come on up.
Okay.
Thank you so much for your comments.
Thank you.
Fantastic. First question. What's one of the things that you've heard from a veteran yourself that has stuck with you the most since you've begun your term as Secretary of Veteran Affairs?
Yeah, well,
Big question.
yeah, great question. Well, look, there's good and bad, right? So I'm gonna cheat and give you two answers because there's two. One thing that sticks with me is somebody I worked with a lot over the years, who's spent a lot of time in the war zones and that the various areas in that big geographic expanse from basically Somalia in the southwest to Uzbekistan in the northeast and all those places in between, including Iraq and Afghanistan. He said to me the other day, Mr. Secretary, I got to tell you, I have my TRICARE option. I haven't fully given it up, but I like so much what I'm getting at my VA that I'm spending a lot of time at my VA. And I thought to myself, this is somebody who has options. That's not the case for all veterans. They don't have options. He has options, and he's choosing VA. I think that's great. Another thing, though, that sticks with me is I've heard, Secretary Austin and I have done a series of events together with a really remarkable group of women vets who are basically challenging us and helping us think through how we address a whole range of issues from what we call MST, military sexual trauma, what the VA, what DOD calls sexual assault. And the stories I've heard from that group about what they've had to endure to get access to care embolden me every day to make sure that we're doing a better job. So those are two examples.
So you started out talking a lot about COVID and the COVID-related issues. The VA was the first federal agency to require its employees to be vaccinated
Yes.
against COVID-19. What is, and I think the deadline was just last month, October 8th.
Yep.
So what's the percentage of VA employees who've been vaccinated as of today? And talk a little bit about maybe some of the good things and maybe some
Yeah.
struggles that you've had with the whole.
It's a great question. So we're still, as our press corps who's covering us every day knows, we're still getting all of our data together. As of this morning, I think we're at basically 91% of our healthcare professionals, the first to have to fulfill the mandate. 91% have uploaded their data. About 2 weeks ago, when we first started reporting the data, we were at 70%, so we're almost to 100% people actually uploading their data. That's one piece of data that we have. The rest of it we're building. Another piece of data that I'm increasingly confident in is we first had a mandate for a vaccine in the fall of 2020. We required our healthcare professionals to get the flu vaccine. Under that mandate, about 5.6% of our employees asked for a religious exception. I anticipate, although I don't know for sure, that we will have more than 5.6% this year ask for religious exception. The religious exception for us is self-executing, which is to say we are not going in under to challenge the legitimacy of somebody's claim of a religious exception. And I'm now kind of slipping into a discussion of, the hard things and the easy things, or the difficult things and happy, sad, whatever it is. We may find ourselves, although we're not going to question the legitimacy of anyone's individual declaration of a religious exception, we may find ourselves in a situation where, for example, in an oncology department, or in a spinal cord injury facility, or in an intensive care unit, or in what we call our CLCs, our long-term care facilities. CLC stands for Community Living Center. We may have so many people who have claimed a religious exception that we can't safely provide care to our veterans in those vulnerable situations, in which case we reserve the right to deny religious exception.
So are you experiencing any level of staffing shortage?
Not yet.
Based on?
Not yet, and we're doing all the planning that you would expect, but this is why I started with the recording of the data that we have, because we need the 100% data picture so we can plan accordingly, then we can make decisions accordingly, and then last point, we will make individualized determinations in our very extensively negotiated disciplinary process, the end of which, again, it's an individualized, fact-based determination. At the end of that, if throughout each of these steps an employee still refuses to get vaccinated, they'll be separated.
So should that person still be eligible to receive VA benefits?
That person as a former employee, you mean? Mm-hmm. Well,
or you can take it over to military personnel. Should they also be?
Yeah, look, I mean,
eligible?
I think each of the forces, each of the individual forces, Army, Navy, Air Force, Marines, are going to make their determinations on the nature of discharges. We'll then make some determinations based off that filing. I think the bottom line of all of this is, the goal of it is, speaking from VA's point of view, to get our personnel vaccinated. And I'm talking about our personnel now. Under no circumstances are we considering a mandate for vaccine for our patients. We're talking entirely about our personnel.
Okay. The VA acknowledges that many veterans were exposed to smoke and fumes generated by open burn pits in Iraq. Afghanistan and other areas in Southwest Asia were burning trash and other waste in burn pits for common practice. What is the VA doing to provide needed care for the potentially long-term health effects, which could include cancer and other fatal diseases, which you touched on in your remarks?
Yeah, it's a great question. First of all, that all vets returning from combat, please come enroll with us, and you have access to care for a 5-year window upon your return. So please, when you come home, enroll with us, and we'll get you in care, first and foremost. Secondly, we're looking at, for once you are outside that 5-year window, we're looking at additional innovations so as to increase access to care. We overwhelmingly want our vets to come to us for care. We believe that vets in our care actually have better outcomes and better results. And so our goal overwhelmingly is to get you in our care. So if we can't do it under existing structures, I anticipate going to be in a position to ask Congress for additional authority there. But first and foremost, if you've just been exposed, if you've just gotten out of the service, please come see us. Let's get you enrolled.
The IG
Yes.
recommended modernizing your reporting metrics so that Congress would be in a better position to assess the care the VA is providing to veterans. What steps has the VA taken to provide those reporting metrics?
It's a great question. First of all, I want to underscore publicly here what I say privately and then reiterate what I say to the workforce. I think the IG is a critical partner to our success in ensuring increased access and better outcomes for veterans. And that's on the provision of health care and the provision of benefits. So the IG is a great partner for us, one. Two, I think the IG team is right that transparency on our metrics actually improves our outcomes and our performance. So across the board, Lisa, we have a series of very important metrics that we provide to Congress on a regular basis. Mm-hmm. Some of those are briefed by the individuals you see in the room with you here today. And this is an ongoing thing. It's not just a one and done, we give you the data, you figure it out. We're up there with what we call our SMEs all the time, subject matter experts.
Not to cut you off, but I think, didn't the IG...
Two more thoughts.
Okay.
The third is, the most important metric we get is what we call a V signal, a signal from our vets. And this is the trust scores. We attach an awful lot of importance to this. And if I have one more of my federal government colleagues try to get our people who work on this from us to be hired by their agencies, I don't know what I'm gonna do. These are our people, we want them in our department, they do great work, but they give us the most important signal, which is what's the experience of veterans? Last, there is a piece of data that I think the IG is referring to, which is relates to access times. Mm-hmm. This is something that we have been working on with Congress, with our stakeholders, among ourselves, with the IG, and if there's a better way to measure this, I want to make sure we provide it. And so we're looking at a variety of those, and if we can get to a better measurement, we will. The most important thing, though, is to underscore transparency helps us, doesn't hurt us. I think that's a great strength of VA, frankly, and if there's something more we can do on it, I will.
So what the IG said was that the VA can't compare the current mental health capacity with 1996 capacity because of changes in diagnosis and treatment, service provision, and data collection. So on that specifically, what are you doing?
It's a good question. I'd have to take that one, Lisa, because I don't remember this one in particular. I thought you might be going a different place, which is actually what we can't do right now is compare wait times in the VA system with wait times in the community. So oftentimes we're in a situation where we have a vet who has an option to get the care in the community, i.e. from a private provider or from us. And we want to make sure that that vet can make a decision based on an apples to apples comparison. How many days until you get care in the system? How many days until you get care in the community? That's the kind of data we think it's really important for us to develop, hold ourselves to account to, but importantly help our vets inform their decision making.
I'm going to start taking some questions that came in from our audience.
Take the easy ones. You keep giving me the hard ones.
I'm sorry. Courtney Bublé is a staff correspondent with the government executive, and she asks, how many employees have you disciplined so far for not complying with the vaccine mandate? We're going back to the vaccine.
Yeah, that's a good question.
Do you have any concerns about staffing shortages? And I asked you about that before.
Yeah. So we've begun our disciplinary process. If this all plays out, if the whole process plays out, it could take as many as 3 months from start of the disciplinary process to the end of the process, which frankly I'm quite comfortable with, because the goal of the disciplinary process is not to fire people. The goal is to get people vaccinated. And the reason that we want them vaccinated is because that's the best way we can assure our veteran patients that we've taken every step possible to maximize safety for them. So the first step in that disciplinary process is counseling. So that's why we believe we're seeing much more rapid uptake in the reporting than we had in the first couple of weeks of reporting, why we're at 91% now, and we were at 70 a couple of weeks ago, is because in that counseling, we're both answering questions about the vaccine, but also then getting employees to upload their data.
Another question that was submitted before the luncheon. A whistleblower's complaint revealed problems with the administration of the GI Bill that wrongly denied some vets money that they should have received for college. Record-keeping errors also caused some children to lose out on benefits which they were entitled to. Do you know how many veterans and their families were affected by this? And if so, what is the VA doing to correct the situation?
I am aware of kind of regular oversight and reporting on our GI Bill programming. I'm not sure I know the specific thing that the questioner is asking. So what I'd say to the questioner, please get in touch with us and with our press team. We'll get you a specific answer on that. I feel pretty good about the performance. I feel quite good about the performance of our education team on increasing access to GI Bill benefits, to other VR and E and vocational training options. I'll just say one last thing, because I know this is an issue that some folks have been asking us about. The pandemic complicated the exercise of your your GI benefit, including the housing stipend. We've now, working with Congress, gotten some relief on that at various times. The current set of relief expires next month, December. We're in conversation with Congress about that, about increasing our forbearance on that. If you find yourself in that situation, please be in touch with your member of Congress and with us to make sure that we can continue to accommodate the challenges that came as a result of the pandemic.
Another question for you from our audience. This one from Orion Donovan Smith with the Spokane Review. It's been more than a year since VA's new electronic health record system went live at the Spokane VA Medical Center.
Yes.
And in a recent internal survey, 78% of employees said their problems with the new EHR had worsened burnout, and 62% had made them consider quitting. What do you think about that situation there?
Very difficult.
Yeah.
I'm really glad that you asked the question. It's a major priority for us. We are listening very closly to our personnel in Spokane because of the fact that they're on the front line of testing out this technology. We're also hearing very clearly their patient safety concerns and addressing those as we find them. And so what I say to that is three things. One, to our colleagues in Spokane, I say thank you very much for your forbearance, for your dedication to testing out this new capability, and importantly, informing us on how to improve it. Second is, I say that the lessons that you're providing us will be implemented before we deploy to any further sites. And third is, it's that kind of transparent reporting back and forth that I think will make VA and its electronic health record responsive, first and foremost, to the needs of our vets, and as importantly, to the needs of our clinicians to ensure that we get best possible outcomes for vets.
So I'm going to go personal for a minute. My dad is a vet, Air Force, and he's...
So I say thank you to your dad.
I will.
Okay.
I will. So he hates going to the Veterans Hospital because he's always, it's like, he compares it to being in line, like, with cattle, and the people not moving right and doctors not being good. And this is right here in DC. Mm-hmm. So when you say that you're moving to make sure that systems are improved, can you talk more specifically about what you're doing? Are you sending teams in? Are you conducting surveys? Are you doing surprise visits? What is the VA doing specifically?
Yeah, well, I think the most important thing to highlight right now is we want to hear from people like veteran Matthews. Is your dad's last name also Matthews?
It is.
About his experience. This is why the V signal is so important to us. So that is a routine signals check with our veterans about the care they're getting so that we can be responsive first and foremost to him and to his needs. So V-Signal is a survey. I think we're doing a good job of employing it. Secret shopper, surprise visits, IG oversight, congressional oversight. These are all parts of the answer. And by no means do I believe that we have gotten everything right. But I do believe that we are becoming more nimble and responsive to important signals, as I said in the speech, from our veterans, because at the end of the day, we work for them, and that'll be the sole determinant for our success. So until your dad starts telling you that he likes, until he starts telling you that
Nobody
he
likes going to the
VA.
doctor.
Well, nobody likes going to the doctor. I mean, especially not me, but that said, I don't want your dad to feel like he's on a cattle farm. I want your dad to feel like the hero, the dedicated public service and servant and patriot that he is.
Awesome. As of now, retiring veterans don't get their service rating until after their last day of service.
Correct.
Why not move that date to 30 to 45 days prior to separating so they can better plan and have a better idea of what their income will be in retirement?
I think that's a good question. I think it has to do with our authorities on when we get access to and control of the vet. I think the bottom line is also something that Secretary Austin and I are spending a lot of time on, and to his great credit, he's spending time on, notwithstanding all the challenges he has. I keep running into former mates of mine in the national security space who always say, geez, I wish when I were active, I spent a little more time thinking about the transition out of service of our vets. But fact is, no DOD leader is rated on how do your vets do when they leave. They're rated on retention and readiness. And as soon as you have somebody who's leaving your service, you're not measured on how he or she does. And so we have to figure out, and we're spending a lot of time together on this, and to his great good credit, as I said, among the many, many things on his agenda, Secretary Austin has insisted that this be one of them. We have to figure out on how to increase our aperture. Ours reaching further into the active force, theirs reaching further into the veteran force, so that we warm up that handoff and sync it up so that vets can make some plans about their future. That said, in the programming as transitioning vets, don't miss the opportunity to press guys who work for Mike Frew in that transition program. We have people in TAP every day that you're there who can answer questions for you to try to give you some greater sense of what to expect.
One final question. Well, no, that's not true. Everybody knows that I never do final questions. Jen Judson
we're
from the
staying here
Defense
forever?
News. We're staying here forever.
Holy mackerel.
President Biden proposed an infrastructure plan with $18 billion for upgrades to VA hospitals
Yes.
and medical centers.
Yes.
That was dropped from the final bill passed last week, right? So do you see any other way of getting that money, and without it, can those locations still be upgraded?
Good question. So it was dropped from that bill and moved on to the other package. The other package is pending in the House, subject to the CBO score. That number has been reduced to $5 billion now. It was 18, it's reduced to 5. We think that's a really important investment in our infrastructure. In all cases, it is a down payment on a facility where our infrastructure is, on average, hospitals 59 years old. We have to have more up-to-date hospitals. By the same token, we are, because of the generosity of Congress, we are able to make investments like the one we opened yesterday in Worcester, Massachusetts, which is a new state-of-the-art clinic co-located with the University of Massachusetts School of Medicine Teaching Hospital, which is a unique opportunity for us at VA and our vets to get world-class care. The problem there is not lack of funding. The problem there is it took us 6 years to get a relatively straightforward building located and built. We just have to get better at that. And there's too much red tape, too many hassles. Some of that is statute, some of that is our processes, and we just have to get better at not only we need more money, as the question's asking, but we have to get better at investing in a more timely way the money that Congress does give us.
Okay, before we wrap today's discussion, and don't go away, Let me take a moment to thank Headliners co-team leaders Donna Limon-Leger and Lori Russo, Headliners member Kevin Winsing, the organizer of today's lunch, Club Membership Director Kate Helster, and Club Executive Director Bill McCarron. I'd also like to take this moment to let you know that there is still time to sign up for the very first Run for Austin virtual 5K. Secretary mentioned our journalist who was detained, Austin Tice. We are running to raise awareness about Austin. He is a Marine combat veteran, and he's been unjustly detained in Syria since 2012. Yes, thank you so much. So he's been unjustly detained in Syria since 2012. So you can sign up at runsignup.com/race/DC/Washington/run for Austin 5K. So please do that to support Austin Tice. So my final question in the remaining 5 minutes, actually I've got 2 final questions.
You weren't kidding about the no
No,
final
I
question.
wasn't. Because I didn't get a chance to ask you about the homeless folks out in Los Angeles, and you mentioned that.
Yes.
Talk a little bit about the priorities that you have for homeless veterans and the work that you've done out in the Los Angeles area for veterans there.
Yeah, thanks very much. So I was in LA about 3 weeks ago or 4 weeks ago now. We established 2 goals by the end of the year. The first was that we would ensure that everybody living on what's called Veterans Row, which is a homeless encampment for homeless veterans just outside of our West LA VA Medical Center. That is an encampment in which upwards of 50 veterans were spending every night. We thought that that was unacceptable, so we announced a goal that everybody in that encampment would be in sustainable or transition housing and programming by November 1st. That we succeeded in that first step. The next step is that we find and house in similar transitional or sustainable housing 500 additional veterans in LA County by the end of the year, meaning that they would be in houses for the holidays, which is, I think, the least we should do. There are about 4,000 veterans in LA. We are in the process of establishing a by name manifest of those individuals, so we can work through each of them for the requirements that they have to get them into housing, including addressing any issues that led to homelessness in the first instance, substance use disorder, untreated mental health challenges, joblessness, involvement in the justice system. That's our goal by the end of the year. I hope that all of the progress that the momentum we build in LA leads to a re-sparking of the momentum across the country, which led during the period of 2009 to 2017 a halving of the number of homeless vets in the country, reducing by half the number of homeless vets. I want us to get this job finished, and I think we can do it.
Is there another area outside of Los Angeles that you plan to have a similar program?
Well, we're about to make a series of announcements about what we call SSVF, Supportive Services for Veteran Family programming in cities and regions, counties all across the country. This happens to be a problem in many cities. And so that will give you a sense of how we're prioritizing this across the country. And by no means am I saying we're waiting to move in those other countries, in those other spots of the country. But it is really important in my view that we build up momentum in LA to demonstrate to the country that this is indeed a very fixable problem.
Okay, and just to prove that I do like to ask fun questions, because I know I've been really hard on you.
Tough.
I understand you played a little football in college.
I did.
Yeah. 2 titles in the MEAC.
Yes,
Played safety.
I did.
Who do you like? Who do you like right now in NFL?
Oh, I'm a Vikings fan.
Vikings?
Doesn't
Okay.
mean I like them, but I'm a
Okay,
fan.
so if you were playing today in the NFL, who would your go-to safety be?
Oh, geez. I think I think if I got a chance to name my Gote safety, I'd just suit up myself and go out there and play.
Well, to express our gratitude for your presence here today, Secretary McDonough, I want to present you with the very coveted National Press Club mug. Thank you so much for coming today.
Thank you. Thank you. Thanks, everybody.
Thanks again, everybody. Enjoy the day.